Starting Monday, a new group will be allowed to give the COVID-19 vaccine.
And these are people who are born with certain conditions that make them high risk. 10 TV's Kevin Landers explains a Blacklick family isn't happy after being placed on the list first, but then taken off.
Natalie Mert says her husband Bob was eagerly waiting to get a COVID-19 vaccine. She says he was diagnosed with a lung disorder and a form of leukemia.
Because of that, treatment essentially has no immune system.
That makes him immune compromised, a condition she says puts him at high risk.
We've been told that, if he contracts the virus, he's every bit as at risk to be hospitalized, to have serious complications, to not do well battling the disease.
Under the state's initial release of high-risk conditions, severe lung disease, a broad term, was listed. On Thursday, it was replaced by specific conditions like asthma. That left Murch angry that her husband's condition no longer qualified.
He'd already talked to his pulmonologist at OSU, and they just said, we're waiting on the protocol, and then the day that he's supposed to be able to start registering, all of a sudden he's not on the list anymore.
Dr. Bruce Vanderhoff is the state's medical director.
The data currently on the way that the vaccine works in those who are immunocompromised is still not entirely clear. And while it pains us to know that there are those who are desperately waiting for their chance to get the vaccine, I also know that we're going to be best off if we follow the science.
It's not the only condition that's caused controversy. The state also distinguishes between those with type 1 diabetes. Only those hospitalized within the year qualify for the vaccine.
While there's no question there is benefit to both of those diabetics, there's also no question that the diabetic who has had the stormiest course with their diabetes is the person who's at the greatest risk.
In the end, Dr. Vanderhoff says it's a difficult balancing act, how to divvy up a short supply of the vaccine with a huge demand. As for Natalie's 56-year-old husband, he still waits for his spot in line.
I understand being patient. We've been patient.
Kevin Landers, 10 TV News.
Now, we just got an update from the Ohio Department of Health about why severe lung disease was removed. It reads in part, quote, right now, the focus is on early childhood conditions that are carried into adulthood, which put patients at a higher risk for adverse outcomes due to COVID-19. Cystic fibrosis and asthma are two of the best understood childhood lung diseases which persist into adulthood and are impacted by COVID-19.